We're going to get through our welcomes, and then we are going to hop into a review of the problem statement, root causes, and starting point. So again, like I said, we are going to continue building on the progress that this group made at our last meeting, and get to talk about where we go from there with our root causes and the starting statement. Shanae also has a divergent thinking activity planned for us. We're also going to talk about some goals. You all know this process very well. Whenever we are going through a new community health improvement plan, we talk about our shared goals. And then, as usual, we are going to have our community announcements and wrap up so we can give you all the rest of your Thursday.
Thank you so much. I appreciate that. All right, and I do just want to give a special shout out. We have a couple of students with us from the University of Maryland. I know they reached out to join as observers, but as always, you are a part of this community as well. So feel free to speak out and join the conversation if you feel so led to do so. But I just wanted to give them their official welcome as well. So thank you all for being here, and thank you all to our partners for always hanging in here with us through this process. We definitely appreciate you all and can't do this work without you. So I really just wanted to, again, just ground today's goal setting conversation and just quickly review the selected access to care problem statement, the root causes we identified, as well as the CHIP action plan starting point that you all voted on during last month's meeting. And I always like to ground our conversations and kind of do a quick recap, especially to be helpful for anyone who may be joining us for the first time today or who may have missed the previous month, just to make sure that we're all building from just our shared understanding as we go into this next phase of drafting our goals. So exciting work to come. So the problem statement, you all are familiar with that. That was selected by our CHIP steering committee. Essentially just highlights that health literacy challenges make it difficult for residents to navigate available services and resources in the county. And our data from our community health assessment kind of allowed us to see that by revealing that limited health literacy combined with insurance gaps and other barriers to care was making it pretty difficult for our residents to access and navigate those county services and resources. Now, back in November, we used the 5 Whys approach to dig deeper into what was driving some of these trends. So instead of stopping at just the symptoms, really try to push that conversation forward and dig a little bit deeper into those systemic drivers. So things like barriers to health education and communication. So we talked a little bit about how a lot of the health information wasn't written in plain, simple language. There wasn't as many translated materials available as well. We talked a little bit about provider communication gaps that reflect some training limitations as well as time constraints. We also talked a little bit about early life literacy opportunities, particularly with our youth and students in elementary schools and middle schools, and how a lot of that is dependent on factors like school funding as well as family support. We talked about fragmented services that make it hard to navigate health systems, especially as many of those systems are really designed in complex ways that assume higher literacy levels for patients and clients. And then there was also conversation around digital access limitations. So, we used these root causes last month to determine where our action plan brainstorming should begin. And so that's where we identified our starting points. So if you remember, we had some conversations around these starting points and we polled the group, and overwhelmingly 91% of the group voted to start our goal drafting and our strategy development, focusing on efforts around clear centralized health information, specifically how to ensure residents can easily find and understand health information about services and benefits that we provide here in the county. Now, while 91% of us voted on that health information, it is worth noting that the remaining 9% of the votes were all unanimous in that they identified navigation and care coordination. Now, during our discussion last month, we did acknowledge that, we recognize there are many ways that we can address this selected problem statement, but rather than trying to tackle everything at once. We really just wanted to commit to identifying a strong starting point. Again, something that felt urgent yet feasible and could align with a lot of the current efforts that already exist. So a lot about quality over quantity. And then we also recognize that even though we voted on starting with clear centralized health information, our broader goal, as well as some of the strategies that we develop, they may naturally incorporate elements of some of these other starting points. So there might be some overlap when we really get into the specifics of our goal development as well as our strategies. That's totally fine. Remember, the idea is really just that we're beginning broadly and then slowly starting to narrow our focus towards more actionable and equity-centered CHIP strategies, and really start to determine what success looks like over the next 3 years for us. And so that brings us to where we are today. We have our problem statement. We explored the root causes of the problem. We identified a strong starting point. And so now it's time to streamline even further to begin to draft or set an overall goal for our approach. And so to do that, we're going to use divergent thinking. For anyone who might be unfamiliar, really it's just a structured way to kind of help us better generate many ideas quickly, or exploring possibilities, even some unexpected ones, before we start to narrow down. So in other words, we're opening our lens first and then narrowing down later. So again, starting broad and bringing things in a little bit more streamlined. So I want to start with something very simple, and I want to give credit to Caitlin, our co-chair, for this idea. But we're posing the question, what are all the possible uses for this fork? So when you see a fork, think of all the different uses that you can use the fork for. And you can write in the chat, you can unmute yourself to speak out loud, and it's okay to start with the obvious. But what are all the different things that you can do with this fork? Again, you can use the chat or you can unmute and speak out. Olalade says to eat. Yeah, eat a salad. Great. Any other suggestions? Eating spaghetti, eat. I'm seeing a lot of eats. Okay. Eat, pry open a can, brush your hair, dig. Great, Crystal. Lisa, pick something up. Yep. Tarnisha, poke holes in a paper. That's a great idea. I've never done that, but I might have to try next time I don't have a paper, a hole puncher. Christina, defend against lunch thieves. I love that. Should have used that at my last job. Dr. Carter, use it as an antenna. Yeah. Roslyn, open an envelope. Awesome. Any other thoughts or ideas? Tanya, grab, tear, dissect, and flatten something. Love it. We have another 10 seconds in case there's anyone else who wants to offer a suggestion. I think someone in my last work group said they used the fork to screw in like a nail or a screw. If anybody has seen The Little Mermaid, Ariel uses it, I think it's a dingle hopper, uses it to comb or twirl her hair. Christina, close an open electrical circuit carefully with rubber gloves. I love that. Yes, thank you. Great. Yes. So notice what happened, right? We moved beyond the intended or obvious use of the fork. We saw many people say that they're using the fork to eat something. And then we started thinking a little outside the box or a little bit more creatively, right? So some ideas were practical, some might have been a little silly, and some were surprisingly useful. But that's essentially divergent thinking. So again, we're generating many possibilities really before narrowing in. And this really helps us to see what options we might otherwise miss, what suggestions we might otherwise miss. And so I want to use this similar thinking to our goal, but a little bit with a twist, right? So I need everyone to use your imagination and imagine we're all in a room together. I know we're in this virtual setting, but imagine we're all in a room together, and imagine there is a bowl of pasta in the middle of the room. and everyone in this room has a fork. Now, we said as a whole that we would typically use the fork to eat. So imagine some of us are using this fork differently, right? So for example, some of us may want to twirl the pasta with the fork. Some of us may cut the pasta with our fork first. Some of us may want to scoop it all up and take a bite, depending on how hungry you are, if you have extra napkins, right? And some may not even use a fork at all. Some may be like, you know what, give me a spoon. I'm just so hungry, I'm going to use my hands. But if everyone acts independently, right, we're all trying to use our fork with the same goal in mind, and that is to eat the pasta. So essentially, that's duplication. But if we pause and if we coordinated with one another, maybe instead of us all trying to bum rush this bowl of pasta, what if one of us gathers more ingredients? What if, say, AJ prepares and seasons the food? What if Rosalind brings an extra serving bowl? What if Dr. Carter decides to set the table? And what if Taylor, for example, helps us to portion the pasta for each plate that's now on the table, right? Everyone now is contributing in some way. And now, not only does our meal have flavor, but there's space at the table for everyone, and there's more food to go around. And so this meal now works because our efforts are coordinated. So even if everyone contributes differently, we're all still working towards the same shared outcome. And so our coalition work is very similar. We all hold forks. Some of us have programs, some of our forks might be outreach, some forks might be services, some might be data, some might be expertise, some is experience. But if we all operate in isolation, we're all competing for the same pasta or the same goal. But if we're coordinated, we can create a full meal and potentially feed a lot more people. And I think that's why our coordination makes our collective impact stronger. And so I want to kind of use that thought process as we go into our goal setting. Now, typically when we draft goals, people often jump straight into solutions. They jump straight into problems, programs that exist. And that's great, but that's also like we're only thinking of eating the pasta with the fork. Divergent thinking lets us take a step back. It gives us an opportunity to brainstorm and to ask or answer questions like, what could success look like? Who benefits from this plan and how, right? What might we be missing if we only stick with familiar approaches? Maybe we need to consider some bold new possibilities or some additional creative possibilities, right? So by thinking broadly first, we're giving ourselves more options to design a goal that might be more ambitious, that could be a little more inclusive, and a lot more innovative. So before we jump directly into solutions, we're going to take this next step and get a little clarity on what our destination is or where we're trying to go. And so that brings us to the core question, which with our problem statement in mind and our starting point in mind, what would success look like, let's say 3 years from now, right? Because our CHIP is a 3-year plan. So 3 years from now, with our problem statement, our starting point in mind, what could success look like? And we know that, access isn't just about availability. So when it comes to these resources and the services, it also is about understanding. So what would success look like with this consideration? And what I'm going to do is I'm actually going to share a whiteboard with you all today, and we're going to do some brainstorming together. Right, so I've provided for you on, AJ provided the problem point and starting point in the chat as well for your reference. But again, with our problem statement and our starting point in mind, what would success look like for individuals, for families, and the community? So we're not quite looking at goals just yet. We really just want to think broadly and answer this question. If we were successful 3 years from now, what would that look like? What would be different? And again, feel free to unmute yourselves. You can use the chat, whatever you're most comfortable with. Olalade?
I guess with the goal in mind, I know we're not talking about the goal, but I guess success would look like having a centralized way of disseminating information so that people know where to look for the information, and everyone in the community kind of has an understanding of like, okay, this is where we go to get health information.
Yes, love that. Thank you.
You're so welcome.
I can suggest something.
Sure.
Using plain language and clear communication could be another.
Yes, love it. Plain language, clear communication, considering information in other languages. Any other
Yes.
thoughts?
I think that language access.
Yeah,
hmm
love that. Thank you, Dr. Rantes. Christina, when someone experiences a new health problem, they can easily find out where to go or look for resources. Absolutely. I think we can all agree that most people go to Google, right? Sometimes that can be a little scary because Google will tell you things that you're like, wait a minute, I just had a little crick in my neck. I didn't know that meant death, right? It can get a little extreme sometimes. But yeah, so where can we go? Where else can we go besides Google? So
I
maybe
was gonna,
something. Oh, go ahead, Crystal.
oh,
Or just,
I was just thinking kind of broadly, and to piggyback off of what Christina suggested, like, you can easily go find out where to go to look for resources. So, like, if you take it a step back, like in 3 years, maybe there's more robust programs in schools, in pediatricians' offices about just health education in general, so that people are more in tune with their health, how to ask questions, how to access care, where to look. And then, you kind of take it a step further to like for families and the community, just then everybody has more of an awareness and, possibly it can kind of trickle out to, the access to it. It has to be more than just a QR code
yeah,
or something online because not everybody can access that. So those are good places
yeah,
to start, but then it's also got to be like, I don't know, at the library or,
yeah.
public places where people can, um, really, I guess, find the information that they need and just have it more available. So I don't know. That was just my like very basic general initial thoughts.
No, I love that. And it touches on some of the root causes that we talked about, limited digital access, the health literacy at, at younger ages, right? And making sure that it's across the spectrum, as well as inclusive for all families of different cultures, different languages. So I love that. That's great. I see Miss Tanya with a hand, virtual
Oh,
hand.
yes. And this may, forgive me, I'm a little under the weather. This may, I'm piggybacking off of what she just was talking about. I work with population health, so a lot of our patients happen to be 65 and up, and quite often when we're speaking with them over the phone, trying to tell them all that information is too much for them to write
Yeah.
down, especially if they have, plain language as you all were talking about, but if they have any kind of visual impairment or hearing
Yeah.
impairments,
hmm
or they'll say, "Can you send it to me?" And they always say, "Can you just mail it?" They may not even have access to a computer, know how to use a computer. So just having some written literature in combination with the online um, information is helpful for the population of folks who prefer something written, which I still do, or they cannot
Absolutely.
really follow it online. So just
Yeah.
having that access to that in plain language and maybe just like bullet points, nothing long and drawn out because they'll probably lose interest in reading it. But something that just gets straight to the point and gives them here's the issue you're having. This is the solution. This is where you can go to get the solution taken care of or assistance to get the solution taken care of.
I love that. Yeah, I think we talk a lot about the various languages and cultural differences, but there are also people living with disabilities that need a little that could use greater access and different things like that. So I love that. Thank you for bringing that up. And something that kind of came to mind when you were speaking was that we have to make sure that the information that we share regardless of the mode that we are sharing it, is consistent, right? So you might have a pamphlet that says one thing, but your website says something completely different, or another resource might use different language or more complex medical jargon versus clear, simple language. So we want to make sure that the information that is shared is consistent. I think I saw Dr. Blount first and then Margaret with a hand raised. Yes. Dr. Blount?
Can you hear me? Hello?
Yes. Hi.
Oh, hi. Hello, hello. So I would say that success could look like community members being creators of health literacy information as opposed to being primary recipients. And that looks like also having community members more involved in health policy creation, and in the policy advocacy process as well, so that they are aware, because a lot of the if we look at this top down approach, is like created and then it's like we have to disseminate the information, and folks are not a part of the conversations, um, so that they can understand it from a macro perspective, you know what I mean, and be a part of that process. And it can be very empowering. So that would be my 25 cents.
I
Thank
love it.
you.
It's more like 50 cents, but that's great. Great feedback. Thank you, Dr. Blount. I think it was Margaret.
Thanks, Shanae. I was just thinking about there's an overload right now of information, but people don't know where to go. So how do we find a way to communicate once this wonderful, centralized, consistent platform exists? How do we get them to know that's where they need to go? So I think it's, because now I think there's 211, there's Find Help, there's hospitals, there's health departments that have similar information, or it may be information that's opposing one another, but there's a lot of information. So I think it can be overwhelming if people don't know where to go. But if we build this wonderful platform, we'd also need to know how to get this advertised, that this is the place to go for a one-stop shop.
One-stop shop. I love that. Yeah, that's great. I think that's going to take some partner coordination, because I feel like regardless of, information that can be shared across partners, and again, should be consistent. So whatever entry point clients or patients are coming into receiving services, we know that however way they're coming in, whoever their primary contact is, that information should be consistent across the board. So yeah, I do agree that there should be a centralized way, and we have 211 and we have Find Help, and the last work group even mentioned those two resources, but how even with those two, there's some discrepancies with information. 211 might have something that Find Help doesn't, or vice versa. And how do we keep this information updated? Who's responsible for that? So yeah, so love that. One-stop shop. Any other thoughts or feedback?
Yes. Shanae, I think a lot about the missing middle, and we are defining community. And so I think success will look like these public-private partnerships, where many of these like big companies in our area that employ what we like to call like professional people, would also be a part of this conversation in a way that will help with the dissemination of the information. And how I'm thinking about it is like, sometimes we think about community, we think about the most, kind of under resourced, kind of like high economic disadvantage, highly economically disadvantaged. But a lot of times those folks have family members who may be the one who made it, you know what I mean?
Yeah.
And that is the person that they are depending on to kind of help them, but that person is not aware of how certain systems work, you know what I mean? And so a lot of times they're overburdened and just trying to do a lot of things themselves and can't help their family members to navigate these systems, because we don't make sure that other organizations that are not like community based know about what's happening in the community. It's like the marketing is just exactly like to the potential recipients, but not the people who are not in the system that can broker access and visibility for like their family members who need it without them taking on the burden. You know, I'm here for the strong friend, trying to figure out how to alleviate
Yes.
some of their stressors. And I think in a perfect, you know, while we're ideating, we should really think about how to make sure that the information surpasses, you know, the community as we defined it in a public health sense. And that's my other 50 cent. Now I'm at $1.
Now we're at $1. I love it. I love it. As always, thank you, Dr. Bott, for your insight and input. Any other thoughts? I think there's another comment in the chat from Christina. Goal: digital health resources are accessible and intuitive for users to navigate. Shanika, hey Shanika, education of a trusted community member. Yes, love it. This kind of makes big CHWs and things like that. Caseworkers. Love that. Great. Let me give another 30 seconds and then we can move on if nothing else. Any last minute thoughts on what success could look like 3 years from now? What changes you might like to see? Who should experience that change first, maybe? Well, hearing none, I want to kind of take another quick glance at everything. Here's all that we've put together so far, and looking at these suggestions, thinking about some of the conversation that we've had just now, what are some of the common themes that you see? There's some common themes across some of these suggestions. Sorry, making it a little bit smaller.
Centralized, that has been a recurring theme.
Yes, centralized. Any others? Let's see, comments in the chat, a desire for more information, centralization. Yep. Olalade, making sure the community knows where to look for information. Okay. Go where to look. Shanika, the county has no wrong door for health information. Okay. And Tarnisha, accessible information. Love that. Sure. Love that. All right. Any other common themes? We have centralization, we have accessibility or access. Yes, clarity, clear and consistent information. Yes. Clarity and consistency. Love that. Maybe even a little bit of navigation support.
Community involvement.
Community involvement. That's great. Great. Awesome. This is wonderful. Okay. Well, great. So now that we've talked a little bit about what success could look like in the next 3 years for us, and we've identified some common themes, now let's start to shape some of these common themes into a draft goal. So again, this is all about drafting. We don't need perfect language right now. I can clean it up after the meeting for us, but I want to use a goal setting formula as a guide. AJ, can you drop these common themes in the chat for us? Because I know when I move this screen, we won't be able to see them anymore. I want to move our viewing over here. Thank you. All right, so looking at our next board, let's use this goal setting formula at the top. So we either want to increase, improve, or reduce what, for who, by how much or in what way, by when, right? So our time frame or our when will be sometime in the next 3 years. So we don't need to really have that figured out today or right now. We can figure that out once we really start diving into our strategies in the next month and beyond. But really, let's just focus on some of these other key pieces first. So using some of these common themes, thinking about the problem statement, thinking about our starting point, let's start to kind of just drop some ideas together. And I've provided some examples here on the screen for you as well to kind of get your brains thinking about ways that we can structure some of these goals. Again, not looking for perfect language, but an example, for instance, if we're looking at access and clarity, one example might be to increase access to clear, centralized, and culturally responsive health information for our county residents by launching and promoting a user-friendly multilingual health info hub, right? That could be one example. Or if we wanted to look at navigation support, an example might be that we want to improve residents' ability to navigate health services and benefits in the county by increasing awareness and use of centralized health information resources by 30%, right? We don't have to get that specific if we don't want to, but we can if we have a way to track it, right? So thank you, AJ, for putting the themes in the chat as well as the statement and starting point. But how can we start drafting some of this? Again, not looking for perfect language. But if you were to draft a goal for our strategic plan, our community health improvement plan, what would that goal be?
Janae, I think you hit the goal with the example.
Oh, I mean, yeah, we could use that too. I was just like kind of brain dumping. But that could be one if we wanted to. That's something that the group wants to agree on. That's totally fine. If
I
you want to
second.
tweak the language a little bit or however, Dr. Blount.
Well, I mean, whatever you just said, it's in the recording, right? Like I second. I just want to second it.
Oh,
I
okay.
want to second.
Awesome. Well, thank you. For both, or is one over the other?
The first one, increased access to clear, centralized, and culturally responsive health information for Prince George's County residents by launching and promoting a user-friendly multilingual health information hub. Yeah, I think it brings in all of the themes, if I'm not mistaken.
Okay. I love that. Thank you for your
As long
feedback.
as we have an expansive definition of community, that would be my only two cents.
Oh,
That's my claim to fame.
I love it. Holiday, I agree. Okay. Great. I didn't mean to do that for y'all. I was just dropping, brain dumping. Any other thoughts?
I would add, I guess, for to this uh, Prince George's County residents and like businesses, because I think business owners are very important to communities. You know what I mean? And they yeah, they're central. So how they should also be responsible for having and health information and disseminating it if necessary.
Okay. So kind of like for those who live, work, play, and visit.
Yeah,
Love
yeah.
it. Okay. Noted. AJ, you mind dropping that? Thank you. You're quick with it. I appreciate it. Any other thoughts? guess something to think about. What does clear and accessible actually mean for different populations, right? So we want to keep equity at the forefront of our minds here when we're doing this planning. So we talked a little bit about those who might speak different languages, those who may be living with disabilities. Are there any other populations or pockets of people we might be missing? I have a comment from Adam, distributing easy to navigate apps that make health resources user-friendly, like find help directly on government websites. Thank you for that. Out of all of our partners here, does anyone else use Find Help or 211, or are there any other centralized hubs that you all might be using currently? And for those who are using one of those or another, what is your general experience with that? Ms. Tanya?
I've used Find Help a lot. I'm a I do a lot of social needs with patients because I'm a community health worker for the practice.
Okay.
So I have logged in and created my own account, and it helps me track who I'm helping because I can send it to them through text or email. Some of the information on there, you can apply for referrals directly from the actual information on there. And what I do like about Find Help is that you can I've gotten on there and there's been discrepancies, like the link didn't work or something was out of date. You can send it to, it's like a hyperlink down on the bottom of that resource, that particular resource, and says if you find a discrepancy or something wrong, please click here, and you put in there what's wrong, and usually they fix it within a week or two. They're usually pretty good with updating it, usually for most of the resources, at least the ones I've experienced or used for patients. But I do like it because, again, it helps me track who I've given resources to. I can communicate that back to the team because I'm the coordinator for social needs, but we also have nurses who do the health pieces like diabetes, hypertension, and we can kind of collaborate if necessary. And I do believe the app has a where you can do teams. So if you have a team of people that are working, so it's, several members that are working on the patient for different reasons, they can kind of see what has been given to the patient. So for me, Find Help, I prefer that over 211 personally. Find Help has been a great resource for me, and we use it all the time with our pop health staff.
Thank you. Thank you for that, sharing that. Crystal also has a comment. As an MCO, we have a partnership with Find Help. It is integrated into our documentation system as well. Love that. Shanika, comment, during COVID, we found that everyone does not have access to the internet or smartphones. Agreed. Economic barriers should also be considered. Absolutely. Dr. Arantes, deploy a community-led health navigator model to bridge the digital divide, ensuring that marginalized populations can access centralized benefits with the same speed and success as high literacy users. I love that. We have a couple hand raised, Dr. Blount and then AJ.
Yes, I'm going to take a stab at this policy piece. So I would say increase health or improve health literacy for community members by policy advocacy engagement by 2028.
Can you expand a little bit on that?
Yes. So my thought is, like, as you know, I've been advocating for the annual behavioral health visit for a few years in the Maryland General Assembly. And, in talking to my clients, I run a private practice. So in talking to my clients about it, like when it comes up or them seeing it on the website and asking questions about it, understanding how much they don't know about how laws shape, you know, what what is allowable and what is not allowable in terms of insurance reimbursement or um, all of the aspects of health policy. Mine is specifically around insurance reimbursement, seeing how that invigorated them to write a testimony or tune into the hearings, or just become a little bit more aware, and I was able to observe how the awareness led to kind of empowerment and participation in this civic exercise that they had not necessarily been uh, involved in before. Also did things for like positive mental health. You know what I mean? Because they didn't feel so uh, burdened without a pathway for their own advocacy. So that's kind of what I'm thinking. So seeing how that can be, replicated on a grander scale by just, offering some popular education and civics education around, how the laws work.
I love that. Thank you. Thank you so much for sharing.
No problem.
And then AJ?
So just try to stay quiet and just take notes so that we can just have our partners giving the information. But I was kind of thinking with the prompt, maybe our partners could actually answer this question, but it could be a part of our goal if we wanted to. Kind of two things. I was thinking of like reducing the percentage of residents who do report confusion about where to find these services, right? If they're like new residents or whatnot. I don't know if we have kind of baseline data for that. And then also I was like, maybe even just reducing the number of times residents have to contact multiple agencies, right? Having to contact multiple different people to get connected for whatever health or social service that they're using. Again, I don't know how. Kind of just thinking, right? Just kind of thinking of goals or whatnot, what we can do. But I don't know how we could realistically measure that if we have something in place for that. Kind of wanted to voice that for the group before I wrote those down. Get you all's opinions.
Awesome. Thank you for sharing. Any thoughts on those, partners and friends? I say jot them down anyway, just so we have a record of what was shared. Any thoughts? Definitely going to need some baseline data for a lot of these things. All right, well, hearing none, there's a couple other comments in the chat. Tarnisha, the health department, Epic, and Ocean is integrated with Find Help. Yep. And Crystal, it would be great if community members could call in to Find Help. I know that contacting our case managers at the health plan allows them to access information over the phone with us. We become a bridge to overcome digital access issues. However, not everyone has WellPoint, so I'm not sure if Find Help has phone access. It's something we can definitely look into. Adam, increase the amount of physical resources in schools, community centers, religious centers, libraries, and third spaces to allow for better accessibility. Yeah. Love that. So making sure that they can find health information, not just online or not just at the doctor's office, but at the library, at the churches, I love it. Places of worship. Yep. This is great. Awesome. Okay. Well, thank you all for leaning into this process with us today. And what we're going to do is we're going to try to clean up some of these goals. I may follow up with a couple of you just to make sure we have clarity on what some of these goals are and that we're actually reflecting what it is that you shared. We'll find some overlap. Maybe we can combine some of these thoughts and goals into one. But again, thank you all for leaning into this process. Next month, we'll share the cleaned up drafted goals with you all. And then we'll take it another step further and we'll go from goal setting to strategy development. And that'll take us over the next couple of months. And we know that that's going to be an important step really to help us determine how we want to operationalize the things that we drafted today. So as always, I look forward to continuing this work with you. Thank you all for your continued engagement. And yeah, I'm looking forward to moving from ideas to action. So with that, if there are any additional thoughts or comments that come to mind, feel free to send me an email. You can email me directly or email the PGHAC email address, and we'll make sure to get your additional feedback and maybe have some exchange conversation as well. But I do want to move to our community announcements with the last 10 minutes that we have. And then we can open the floor for any additional announcements from our partners. AJ?
Yeah, so we'll do a few community announcements. These are great ways to stay connected, share resources, and support one another's work. And as always, I'll be sure that these are shared out after a meeting so you can have them for future reference. So our first one is going to be a webinar for staying social and staying strong. Staying socially connected is just as important for health as eating well and staying active, especially as we age. So you are invited to join this free webinar today, actually. It's going to be at 1 p.m. to learn more about the many benefits of social engagement for mental, emotional, and physical well-being. Next up, we have the 4th Annual Heart Health Equity Symposium, which is going to be on Friday, February 27th. It's tomorrow. The Open My Heart Foundation will host its 4th Annual Heart Health Equity Symposium from 1 p.m. to 3 p.m. at Capital Region Health in Largo. This free event will focus on heart health equity, as well as closing gaps through new laws, and is open to the community. Seating is limited, so first come, first serve. Next up, we have a PG area plan listening sessions. So I'm pleased to announce the upcoming FY26 area plan listening sessions. The goal is to gather meaningful input from residents, service providers, advocates, and community partners to ensure the FY26 Prince George's County Area Plan reflects the real needs, priorities, and lived experiences of those who live and work in the county, particularly older adults, people with disabilities, caregivers, and historically underserved communities. There will be 2 sessions, that's what you can see there, where you can join either in person or virtually. The dates, times, locations are listed on the slide. Next up, we have a funding opportunity. So the Maryland Department of Health is offering 2 new funding opportunities. The first is from the Office of Minority Health and Health Disparities, SDOH program. This program provides funding to organizations to provide community-based interventions targeting the upstream factors that impact health, typically outside healthcare delivery, necessary to reduce health disparities and maintain health communities and populations. There is a pre-application webinar directly after this meeting. However, you can learn more about the program and funding opportunity at the websites provided on the slide. And next up is going to be the Minority Outreach and Technical Assistance Program. That's going to focus on community-based health education and prevention through funding to organizations to support projects targeting chronic disease and critical health areas. Again, you can learn more about the program and funding opportunity at the links provided on the slide. Application deadline for both grants is going to be March 11th by 5 p.m. A few more announcements here. The MedStar 2026 Health and Resource Fair. So please save the date and join the MedStar Southern Maryland Hospital Center in Clinton Baptist Church for a day filled with educational resources and support at their Health and Resource Fair. Saturday, March 14th from 10 a.m. to 1 p.m. at Clinton Baptist Church. If you would like to attend as a vendor, there is a vendor sign-up form hyperlinked on this slide. UMD Capital Region is hosting chronic disease self-management program classes. So this program is designed to empower individuals living with chronic diseases by providing them with the tools and resources needed to manage their health more effectively. The workshop convenes in person for 2.5 hours each week over the course of 7 weeks, starting Tuesday, March 24th. You can visit their website for more info and to register. Then we have the Maryland Wellness Swell Conference and Retreat. So the Maryland Wellness is sharing information about the upcoming Swell Conference. This is a multi-day professional learning and wellness experience, offering engaging presentation and panel discussions, practical tools you can use in a professional setting, a retreat-style setting that supports learning without burnout. The event takes place April 16th through 18th in Ocean City, Maryland, and you can visit their website for more information about the conference or click the link to register. You can join the GOAT Expo team on Saturday, May 2nd at Bowie. Is it Bowie? I got to get that right. Bowie, there we go. Bowie State University for full day workshops, resources, live performances, and support for youth 16 to 25 and their families. So this event is free to attend, and you can register via the link on the slide, and we ask for your support in helping us spread the word across your networks. Chesapeake Life Center just released dates for their 2026 Camp Nabi on August 7th through the 9th. This is a full weekend overnight camp in Millersville, MD, for youth ages 6 through 18 who have experienced the death of a loved one. You can reach out to our fellow coalition member, Carrie Stansel, for more information. Hope Connections and the University of MD Capital Region are hosting a virtual all cancer support group on Wednesdays from 12 to 1 p.m. You can register to attend, to connect with others, feel supported, and gain additional information and resources to support your journey. And with that, I believe that is the last announcement. I do want to pause for any partner announcements.
Yes, at IME, we have a 10-week grief group for Black men coping with grief. You can find information at www.ime.com. I will put the link in the chat. It's a psychotherapy group, so led by grief clinician specializing in grief. Not Mr. Kevin Carter. He's not a doctor yet.
Thank you. Hearing none, I'll hand it back over to you, Janae.
Awesome. Okay. And Dr. Blunt, I think I remember you sending that flyer over to me, so I'll make sure to include that in the follow-up email that goes out. Okay, well, if no other partner announcements, if anything comes to mind, again, you are welcome to email me, or you can email PGHAC, and we'll make sure that gets out to our partners and friends so we can help cross-promote and support your efforts. But if you have not done so already, please scan this QR code. You can click the link that we send out after the meeting, or if AJ, you can drop that in the chat. We are just asking that you all complete this directory update survey so we can get your most recent information. And we know we've had some new members join us, so we want to make sure that we're maintaining an accurate record of our coalition participants. We'll also be using this directory as a way to ensure that we give credit to those who have helped us in this chip development process. So please, please, please make sure your information is provided. We don't want to miss anyone. All right, and then last but not least, this is the snapshot of our upcoming work group meetings for the rest of this quarter. I can't believe March starts in a few days. Oh my goodness. But as always, we welcome you all to participate in any of the other work groups, especially during this CHIP planning phase. There is shared expertise, shared experience, and a lot of overlap, I think, that we're going to have. So please, 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 as always, you're welcome to join any of our work groups. But for this work group, our next Healthy Connections meeting, will be Thursday, March 26th at 11 a.m. I also want to note that we have our quarterly full coalition meeting coming up on March 10th, at 6 to 7:30 p.m. This quarterly meeting will be virtual. The registration link is on the slide. We'll also make sure to drop that in the chat for you as well. So yes, looking forward to having you all there to share all that's been going on with some of the other work groups, with the coalition and with the health department as a whole. And as always, I just want to close to say thank you, thank you, thank you for all of your insight, for all of your partnership. I appreciate you all being here today and absolutely look forward to continuing this work together. So again, thank you all for being here. If you have any questions, feel free to shoot us an email, and have a great afternoon and weekend, everyone. Thank you so much.
Thank you.
Thank you. Have a good one.
You as well.
Thank you.
Of course, thank you. Thanks, Christina. Thanks, Olalade. Thanks, Margaret. Thanks, Tarnisha.